One of the first big stories I was quoted in was with the New York Times when they were looking at, the explosive experience we had here in New Orleans in the very first months of the pandemic. And we're looking for local people who could speak to that particular problem. And then once, one person's, source becomes another person's source, and then I became, on a short list that Tulane Communications built up of people who could be, were willing and reliably, able and available to speak on any number of different topics. But on the local level, I had a whole raft of local reporters who were, at the height of the pandemic, contacting me on an almost daily basis. There, in the peak of the pandemic, it was a lot.
If everybody would wear a mask and pay attention to the most basic of these public health restrictions, we could open up a lot more. It is very, very helpful to us to understand whether we have 20% of the population or 60% of the population that has been infected. That gets to the idea of herd immunity.
Trying to find ways to translate what is sometimes really dense and obtuse information and, in scientific jargon into something that would be more digestible and understandable to a lay population was something that, I felt like I could do.
You have to remember we were testing very differently. We were only testing people who were sick. And if young people are less likely to get sick, they weren't going to have an opportunity to be tested and be identified as positive.
And if your priority is to gather with family and have them around for next Christmas too, then you should wear a mask indoors unless you're actively eating. And I would recommend, given how warm it's going to be in Louisiana this Christmas, that you eat outdoors.
The ship is hitting the iceberg and, we're still having dinner.
I never had any training in how to interact with media. I never went through a media workshop. I've probably broken all the rules that you're supposed to maintain with media. But I think part of what helped me to interact and respond is that in addition to my pre-med training, I trained in theater as well. And so I kind of viewed it as a performance and kind of an, let's see, what's the word? Improvisational performance. I mean, I know my stuff and that helps a lot. I could predict by, the 10th or 15th or 20th interview what kinds of questions they were likely to ask. So, I had that information down cold, and then I was just really comfortable at extemporaneous speaking. I'm not a modeler, so I'm not sure I can get too predictive. I'm a little worried, but I'm also hopeful, because I think that the students that are coming to public health now are really engaged and committed, and they are approaching the subject with a lot of passion, and providing them with the structure in which to make that passion effective is probably the most important thing we can do as faculty. I'm a little worried that I frankly had hoped that the COVID pandemic would wake up policymakers to pay more attention to public health, and that doesn't seem to be happening. And so it makes me a little worried about where we will be in a few years as the current public health cadre of workers and professionals, age out, frankly. And that are we really going to be able to maintain and support, and implement the kinds of things that are going to be needed as we become a far more globally integrated society with the potential impacts of climate change. I think that there are a lot of real challenges ahead of us for public health. And I know we've got the people who can handle it. I'm just not sure that the systems are necessarily going to be, robust and allow us to handle it effectively. I'm hoping we can get ahead of things better than we have in our last couple of experiences with COVID and monkeypox, for example. So that's, my take. I think there's a lot of potential. It's going to be really exciting. I think technology and various applications are going to be incredibly valuable to maximize the impact that new public health careers will emerge based upon that. But I think we've also got to, perhaps engage a bit more aggressively in terms of communicating the importance of public health in a lot of different venues, not just, amongst ourselves and talking to each other, but, talking outside to community groups, to policymakers, and making the case for the things that are part of public health and the benefits that can accrue to a society by fully engaging in them and supporting them. But it is, I look at, the deaths that we're seeing every day here in the United States, 320, 350, 400, 350, and, that's a lot of people dying every single day.
Not over.
It's not over.
It's not over.
It's not over. And, I've used the analogy more than once, and it actually got printed in an article for The Hill a couple of days ago. It's like 2 planes falling out of the sky every day and nobody cares. And that's, from my point of view as a public health person, really, really frustrating that we seem to have lost that empathy for the experiences of the people around us. And part of it's, COVID deaths were out of sight, often for very good reasons. They're not showy, there's not flames, there's not smoke, there's not loud noise. And so it doesn't have that visceral impact that, like, Russia bombing Kyiv does. So that's the other frustration. I was frustrated before COVID because we were willing to tolerate 35 to 65,000 deaths from flu every year. and now we've got, we're going to be, if we can't do better than what we're doing right now, we're going to be at over 100,000 deaths a year from COVID if things don't get better. I think you need to probably focus on the people who are going to benefit the most from vaccination, which is older folks with pre-existing conditions, or older folks generally, and people with pre-existing conditions. So I think it's, interfacing with, diabetes clinic staff, with cardiovascular services, and they're, encouraging them, for all of the underlying medical conditions that we know place people at higher risk of very severe outcomes with COVID infection. I think that's where we need to, interface with them, get health educators into those environments on, heavy clinic days so they can just be, offering information or talk with people, answer questions. I've answered questions for people in Costco. Because, anything that I can do to help clear up somebody's concern would be something I'm willing to do. But I think that it's going to take that. And it would also help if all the mis and disinformation, would slow down. But that's unlikely to happen. It's so, inextricably linked at this point now with politics I think we have to probably get through a couple more election cycles before that attenuates, and just have to kind of keep doing what you can do. And I think the other thing we need to do is we need to catch up all the kids on measles, mumps, whooping cough, everything else that we've slid backwards on, and get people vaccinated with flu. The problem in some respects is that, people here haven't seen polio, in most people in living memory, or even measles, because, we eliminated measles from the United States, from North America, through vaccination routinely for school-aged children. And so I think that we need to, in that case, work on educational systems, school systems, about the importance of, ensuring that, perhaps personal opinion shouldn't be a reason not to vaccinate children. But it's tricky. It's a delicate balance. And I think, again, it's listening to communities and trying to do it in a way that doesn't give oxygen to, the very vehement, very small minority of people who are agitating about not just, vaccines for COVID or vaccines for other things, but masks and books that they don't like. And it's all intertwined. And so I think we need to look carefully and think about how we can influence and provide some information, but it's probably really going to be trying to define, what matters most to you? Doesn't the health of your kids matter the most? You want your kids to be healthy and to grow up strong and be, successful in whatever they choose to do. Well, how can we do that if, we've got these infectious diseases reemerging because people won't take vaccines? That's the challenge, trying to find ways to connect, people to an outcome through the pathway that public health would say would be the best choice. But that's really retail kinds of intervention. It's hard to do on a large scale, and there's a lot of people that aren't on board. I think the broad field of public health has learned from the experience with COVID, sometimes some really hard lessons. And, I think about our own experience here in Louisiana, where early on I was approached by someone who was trying to put together like a businessman's guide to COVID safety, that kind of thing, but couching it in terms of what's good for their business. Because what would have been best for businesses in Louisiana and all around the country would be if they had enforced masking, because then their employees would have been less likely to become infected. Their clientele wouldn't have become infected. The hospitals wouldn't have filled up as much, and we wouldn't have had to undergo or engage in more restrictive and problematic things that would, were limiting, size of people in restaurants and things like that. But that was just not something that I saw, and I certainly wasn't able to get traction with the business community. I talked to a couple of business organizations and talked about the fact that, listen, if you can stay open but people have to wear a mask, isn't that better? Because then you've at least got customers coming in, right? Yeah, it's not as great, but isn't it better than being shut down completely? The idea of finding a way to engage. And I think the experience that New Orleans had when they required vaccination once they were available and or a negative test to get into various venues, was benefit. It worked for the venues and it worked for the health of the population. We had consistently less cases, lower hospitalizations, fewer deaths than Jefferson Parish right next door, which didn't do anything like that. And so, I think it's hitting the people that are in a position. I'm thinking, probably chambers of commerce or maybe, Lions clubs or whatever that business organization is, probably is a place to hit the next time we have to do something major. But I think we also need to be more thoughtful in terms of application of interventions as well. We always, in the history of quarantine and isolation, we never want to do more than we absolutely have to. And I look at what China's doing still, and it's, locking down tens of millions of people for months. Not the whole country, but that's still huge in terms of what that does to disrupting society and education and everything else. I had one of my students who was, studying remotely in China because he couldn't get back to New Orleans, and he got swept up in one of those and he basically dropped out of sight because where they shipped him off to didn't have internet. So I didn't know what had happened to him. He all of a sudden wasn't in class remotely. He wasn't submitting assignments. other faculty were having similar experiences with him. Ultimately, he wound up medically withdrawing retroactively from the semester because he just couldn't, and he was stuck there for months. It was really amazing and unbelievable. That to me is not necessarily the best strategy. I think we can be more finely tuned in terms of how we respond to things. But I think we've got to explain why the decisions are being made the way they are and do a better job of that so people will, because public health is voluntary, that's one of the biggest issues is, the CDC recommends and then the states, decide what they're going to do, and federalism isn't always your friend when you're dealing with a pandemic, easily transmissible pathogen. So it's problematic. But we're not going to change the political makeup of the United States. So, but I think it's just working within the frame that you can and making the difference in the community that you're invested in. The challenge is that humans are reactive. We're still fight or flight animals, and so planning is not really our strong suit. And unfortunately, public health has to have that flight response and reactivity, but it also functions best when it's within the context of a much broader, cohesive plan. And that's
some hunting and gathering too.
Yeah, but it needs some hunting and gathering as well. So it's a really, and I think the challenge is part of what makes it fun. It's not boring, which is, something that can't be said for all kinds of career paths that you could be involved in. So I think that, for people that are engaged and find public health, it provides them with, all sorts of opportunities to expand their own personal horizons and find things out about themselves in addition to doing good for people.